Hi, my name is Alyssa Stanek, and today I'm here, even though it's virtually, with Dr. Katelyn Thompson, who's one of our psychiatrists at UnityPoint Health, Berryhill Center. Thanks for joining me, Dr. Thompson.
Oh, thanks for having me. I enjoy the opportunity to visit about this material.
Yeah. So we thought we would just talk about anxiety and depression. And so I was hoping that you could kind of start us off and just kind of explain the differences between the two.
It's a good question. And we often get that from patients who wonder, what I experiencing, is that really called depression or is it really anxiety? And in truth, they come together so often that it's probably a little bit of both. In some ways, just to kind of illustrate that, there's some symptoms that they have in common. Like certainly both depression and anxiety can affect how we sleep, can affect our energy level. They both can affect how well we concentrate. And there's good reason for those similarities because from a biochemical level, they have a lot in common.
Okay. So can depression and anxiety be self-treated, or how do you know when you might need some help from somebody else?
Well, I think that's, the interesting thing about depression and anxiety, most of us won't experience severe mental illness like bipolar disorder or schizophrenia, but almost all of us at some point in time will know what it's like to be depressed and certainly will know what it's like to feel anxious. So, and thank goodness that for most folks, we can manage that through exercise, through nutrition, through engaging with family members and friends. But yeah, there's a lot of it that can be sort of self-treated. But for some folks, that's not enough.
So we recognize that when you're kind of trying to decide if you need to go and see somebody or reach out to Berryhill Center, that it might be a little bit intimidating. What advice do you have for those individuals who are kind of considering reaching out to get help?
Yeah. My biggest piece of advice is you don't have to continue to feel this way. This is not, something that you're going to have to live with the rest of your life. And I know it's threatening to go and seek out care. But honestly, I think you'll find that your first visit looks a lot like this. It's just a conversation. It's a lot of talking about your history. And it is in depth. It involves probably some questions that you may feel like are totally unrelated to why you're there, but it's meant to make sure that we're treating the right thing and that we're doing a comprehensive look at what can be going on. The good news is most folks will not need to follow with a psychiatrist the rest of their lives. And I think that's a part of the fear that if I start now, am I going to have to go and see this person forever? And most people, it's really just temporary as we get you through those speed bumps and we get you back to your regular provider and we're available for consult. But
Great. And then today's world's looking a little different. I feel like a lot of people are on different pages, whether they want to go places in person or if they're still choosing to kind of opt the more virtual route. Does Berryhill Center offer virtual appointments?
absolutely. And I would really am encouraging my patients as much as possible that we do our visits virtually, just to reduce the risk of exposure for you and for our staff. And it's pretty cool. It really all you need is a working email address and either a smartphone that has a camera on it or a computer that has a camera. And the process for that looks like getting scheduled for that type of visit with us. And then my nursing staff on the day of your appointment will send you a link by your email. And simply all you have to do is click on that. It will download the appropriate software on your device. And then you click on join the call. And it looks exactly like our conversation does today. So.
Awesome. Well, I appreciate your time today and kind of going through those differences between anxiety and depression and just walking through how easy the virtual appointments look. And then it just sounds like if there are individuals who are wanting to schedule an appointment or maybe have some questions, just to call Berryhill Center and the team can help them.
Absolutely.
All right. Well, thank you so much.
Thank you.